I'm Bill Herbst, for those of you who don't know me. I am a real estate agent with Compass, and I am also a resident here at 2 Fifth Avenue. I have been for about 21 years with my husband and business partner, Ralph Gilmartin, of the Gilmartin Herbst team. And to sort of give you an idea, to give you an idea of sort of the genesis of this, through my career in real estate and also my personal life, I've started to kind of like work more and more with older people. And some of them, in fact, were neighbors in this building. And in that process, I've realized that there are a lot of needs and that are often unmet. There are a lot of services that are available to make things much easier that most people just don't know about. And sort of as part of this journey, I'm a founding member of a special group within Compass called CompassPlus, which is launching in June. It's 200 to 300 of our 30,000 agents across the country, and most of us do a great deal of work with older clients. And it's not just a matter of like slapping the Compass Plus logo on everything. I have to be certified as a certified senior advisor by the Society of Certified Senior Advisors. And that is a process which involves 24 hours of class time, 6 textbooks, and a 3-hour exam. So I got 2 more books to go. But it's really been fascinating. And as I get closer to, Medicare and other things, it's been really, really interesting for me as well. So what I'm going to do is introduce the speakers. And then we'll speak for about 5 minutes. We'll have time for a couple of questions. And then we'll kind of move on to the next. And then I think it might be more fruitful if everybody just has a chance to, if you have specific questions, you'll be able to actually meet the people who will be speaking after. And I think we also have some people who are not going to be speaking, but who do work in this space. So at the end of the program, I'll ask them to all introduce themselves because it could be something that would be useful for you guys. So without further ado, I am going to introduce my friend Katie Hustead. Katie runs a company called Paper Moon Moves, and I'll let her take it from here. Oh, and by the way, anybody, if you want, sorry to step on the applause. If anybody would like any wine, food, anything, you have to use the bathroom, just grab me. Whatever, we'll bring it to you because I know it's tight.
Thank you, Bill, and thank you guys, everyone, for coming tonight. It's a real pleasure to be here. I've been in business 15 years helping seniors in New York City, and I'll tell you the most frustrating thing about helping seniors is that there are a lot of resources available that people just don't know about. And so it's important that we have groups like this, and I thank you, Bill, for organizing this. I wish we could tell everyone in New York City about this, because everyone you're going to hear from tonight, I know most of them, and they're all provide excellent services that a lot of people don't know about. Starting with, what is a senior mood manager? It's a very, most people probably have never heard of it. And raise your hand if you know what a senior mood manager is. So we have a few, my relatives know. Good answer, Vivian. So it's a relatively new field. There is a National Association of Senior Mood Managers that started 20 years ago. And that's really when it became a profession. Before that, it was something people did sort of as a hobby or here and there. But basically, we help people move. And most of our clients are elderly. And the reason is that moving is hard for anybody. It's hard for a 20-year-old to move. It's hard for a 40-year-old to move. But it is really hard to move if you've lived in your home for a long time and you haven't moved. So the industry's changed quite a bit, so you don't know how movers work. It's very scary and intimidating. And so this industry sort of evolved, and there's about 1,000 members all over the country. We're one of a handful here in New York City. And basically, if any of you are thinking of moving, you're probably like, oh my God, I wouldn't even know where to start. It's a very stressful proposition. So the way move managers work is we kind of step in and help with any part of the move that's causing you stress. And that could be the whole thing, or it could be a little parts here and there. And just to kind of give you a broad overview, one of the first things we like to do with clients is we take a look at the new space, and we look at the measurements. We'll go photograph it and measure it and look for all the outlets and figure out how much hanging space there is in the closets and how many cabinets there are. And then we go back to you in your home and we look around at all your stuff that you love and cherish, and we help you figure out how to get it there. And if you're downsizing, if you're moving to a smaller space, that may mean going through a lot of your stuff and helping you make some very hard decisions. You may have to leave some furniture behind, you may have to leave some kitchenware behind, you may have to go through your clothes and sort down. We have a staff of 10, including Thea here, is one of our lovely staff. And our staff, when we hire them, we're always looking for the first quality, the most important quality is they have to be nice. Because they are in your home, and they're helping you go through your stuff, and that is one of the hardest things for anyone to have to do, is to go through their stuff and say, do I really need this? Do I really need that? Do I need this chair? Do I need this sweater? Do I need this pillow? And so we go through all that. Our staff, like Thea, goes through all that with you, and then we hire the movers, so you don't have to worry about calling a mover. You don't have to stress about getting scammed by a mover. The movers we've worked with for 15 years in some cases, so we feel very confident about them. We oversee the whole process. We deal with your building if you're in a co-op or a condo, and you have to worry about all those not legal issues, but like, getting the certificate of insurance and dealing with when can the movers come and when can they not come. We handle all that. We'll oversee the move, and most importantly, I think the best part of the job, in my opinion, is we unpack your new place, get it all set up, take away the boxes, hang the art, get the cable set up, so that you can just enjoy your new space. If any of you are considering leaving New York, we know move managers all over the country, and so what we do in that case is we would partner with them, and we'll take care of everything in New York, and we'll say, okay, Vivian's arriving on, her stuff's arriving on Tuesday morning, and the movers meet the move managers that we partner with will meet the moving truck, and unpack and get you all settled where you're moving. If you're staying in New York, we just take care of the whole thing. And then, just really briefly, because I don't want to take up too much time here, a big part of our job is what do we do with all that stuff that I wasn't able to move? And that's the heartbreaking part, right? Because you've culled down your possessions, and you have all these things that you love that are not going to work at the new space, and you don't want to throw it away. I don't want to throw it away. Thea doesn't want to throw it away. So we work with dealers and auction houses, and we sell anything we can sell. And then we make a tremendous amount of donations. So we can donate furniture, clothes, books, decor, art, jewelry, and so tons of donations. And then sadly, there's always stuff at the very end that really can't even be donated, but we will have it removed for you. So that's kind of it in a nutshell. I know that's a lot. Happy to field any questions. Are we taking questions now, or should we save
we'll
them?
take a couple now. And
if anyone has any now, or I can talk to people one-on-one afterwards. So.
Yeah, anybody?
Do you have a website?
Yes. I'm sorry. I didn't say my name or the company name. Well, Bill said my name. My name is Katie Hustead, and the company is Paper Moon Moves. And there's some brochures up there and cards up there. So good. All right.
I have a question.
Oh, yeah.
It's like, this is the typical process take. Does it vary from client to client?
It does vary. Some people, we've had clients call us like years before they want to move, because they just want to kind of start the process of downsizing and going through their stuff. But a typical client will call us about 6 weeks before the move. And that's kind of like the ideal amount of time, because that's enough time for us to make a lot of donations and to sell things if we can sell them, and make all those, make sure we get on the movers calendar. Very good question.
Any fun finds when you're selling items?
Fun finds? Oh my God,
Like
we have.
you know.
We have had some very quirky things. We had a woman whose husband was a dentist, and he used to take home patients' teeth, and she had a whole drawer of teeth. And she didn't think it was worth anything. She just couldn't part with it because her husband had taken all these teeth out of people's mouths. So we helped her sort of select her favorite, and then got rid of her. She also had some of that the filling material that he had brought home that is highly flammable and toxic. So that was the case where we had to call a trauma scene disposal company to come take it away. They had the masks on and everything. So yeah, we also had some fun things too. We've had some great art. We sold Liechtenstein ones for a client.
Wow.
We've had some beautiful mid-century modern furniture that we've helped people sell. Beautiful pieces, jewelry. It just runs the gamut. Yes.
Do you get a commission for those sales?
So it depends. If we work by the hour, and every job is unique. So when we meet a new client, we go to their home and we do a consultation. We figure out sort of what the budget's going to be for our services. If we are introducing a client to, say, an auction house, what an auction house typically does is they will give whoever brings the job to them what's called an IC, an introductory commission.
Okay.
So if they offer that, we'll take it. You know, it's usually not very big. It's a couple percent or something on the sale. Some of the dealers we work with don't give commission. It's really sort of on a case-by-case basis. Yeah. Good question, though.
Okay, well, thank you so much.
Of course.
One of the things I think is great about what Katie does is I know from when my mother moved, if I were helping her, we hired somebody down there in Florida, if I were helping her, I would have been like, you don't need this, you don't need this, you don't need this. And I think Katie and her team are very patient, and they sort of give the agency. You know, nobody needs their kids telling them what they need to take and not take. Even though my mother took like service for 20 to her new one-bedroom apartment, and then moved to West Palm Beach and was like, I'm never getting a dinner party again. Why did I take all this? But you know what? She had to go through her process. So that was it. We have one more seat over here if anybody would like to.
Somebody that might be coming
Okay.
in that would
Oh,
Oh, there's somebody right behind you.
come on in. You're just in time. We've got a seat right up front.
Oh, it's okay.
Okay. Okay, so next, we're going to hear from Diane from CarePatrol.
Thank you. Bill.
You're welcome.
Thank you for organizing, and thank you everyone for joining us. Oh my goodness, this is a beautiful crowd. I'm very glad to be here. I'm Diane Trunececk. I'm with CarePatrol. We are a free senior placement service. The way we get paid is a finder's fee by the community should you or your loved one decide to move in. But what we do is help you to narrow down your options from hundreds of these senior living communities in our area, hopefully to a handful or less, based on not only your care needs and budget now today, but thinking long term as well. And part of the reason that that is so important is because all of these communities are created a bit differently from a care perspective as well as a financial perspective. So in our ecosystem, most of the communities here are rentals, so you pay for your rent and care each month. There are some communities, you might hear of these CCRCs or continuum care retirement communities or buy-in communities. They're not as common in our neck of the woods, however, they do exist. So we can certainly help with that as well. But again, depending on what might be the right fit for you would also be dependent upon what your care needs or maybe any diagnosis that you or your loved ones may have. Because if it's something, if you have maybe an Alzheimer's, dementia, Parkinson's, something that's more of a progressive diagnosis, we really want you to be set up for success and knowing that the care is going to be there for you when or if you may need it. Because again, the reason, as I mentioned, all of the communities are a bit different is because they're licensed differently. So just to give you a brief overview of the licensures, there's independent living, which is no care. It's just simply they provide meals, they have programming that's happening, they have 24-hour concierge services, they have maintenance, and so on with their services. As you move into assisted living, it's going to be some physical care that they can provide for you. And as we move into memory care, that's going to be a locked or secured environment. So it's going to be for people who have more advanced dementias and may also have some physical concerns in addition to that. So the other caveat with that, and why I say they're all created a bit differently, in New York State, we're lucky that we have something that's called an enhanced license that sits on top of that assisted living or memory care license. And the reason it was created was to try to keep people out of a skilled nursing section longer. Skilled nursing is a synonymous term for nursing home or rehab. You may hear of those, or unfortunately you may have to go to them sometimes after a hospital stay. And that's basically like it's like being in a hospital-like environment. So it's not exactly the best place to live long-term from a psychological perspective, unless it's absolutely necessary from a care or financial perspective. So what the enhanced license does is it allows these assisted living or memory care communities, they're in a more home-like environment where you can choose your apartment, anywhere from a studio, 1 bedroom, 2 bedroom. I've seen some people combine 2 bedrooms with a 1 bedroom, maybe to have their studio on the side. We can get creative with solutions, but that being said, each individual community gets to pick and choose the higher care levels that they're willing and able to provide with that care license. So that means things that in other states, if you're in a wheelchair or you have catheter needs or different diabetic needs, special diets, you may have to automatically go to the skilled nursing section, which is kind of unfortunate because it's indeed the most expensive level of care for a less than environment, and typically the staffing ratios are lower. So these communities, assisted living and memory care, again, get to pick and choose those higher care levels that they are willing and able to provide. Working with an advisor like myself can really come in handy when trying to fizzle through that, because a lot of these communities will go with you on the visits to be an extra set of eyes and ears to make sure that what they're selling and what they're saying is actually what is happening. Because a lot of communities will glaze over that licensure piece and say, we have our enhanced license, you can age in place here, we do hospice care. And a lot of people say, that's great, let's go see the apartments. But you kind of need to take a step back, unwind that, and unpack that of what exactly they do. Because there might be 3 communities within 15 minutes of each other, but they can all do wildly different care needs. So if you're not savvy with that, what happens when you do need those care needs and you're in a community that doesn't support the higher care needs, you either have to move out or hire in additional care, which is usually a 24-hour aid on top of what you're already paying. So it can be very pricey. So these are the types of things that we can help you fizzle through. I personally work with all of the communities here in Manhattan, Brooklyn, Bronx, Westchester, Northern New Jersey. And a little bit of spoiler alert, we are expanding and taking over the territory for Queens and Western Long Island. So you'll see me out there more often. But CarePatrol is a nationwide brand, so if there's areas that you'd like to explore beyond what I offer, I'm happy to connect you with my colleagues. So thank you for joining us today.
Thank you. Any questions? I think one of the things, when it was time to put my father into memory care, when my mother couldn't handle it anymore, you find yourself scrambling and you just don't know what you should be looking for. So I wish that we knew about services like you guys, especially since it doesn't cost anything to the end user, because very often you make these decisions under duress. So when my mother had surgery and on a Friday at 3 o'clock they were discharging her, and they said, okay, she should go into a rehab, and I was in a different state on the literally just Googling, and anyway, it all worked out. But that's what I think what you do is one of the reasons is so important.
Thank you, Bill, and thank you for sharing that, and that is a very good point. Again, if you or your loved one do have a progressive diagnosis, the earlier you at least start looking and learning, the better, because a lot of people, especially when it comes to a dementia diagnosis, and dementia is an umbrella term. There's all different types of Alzheimer's that can be specified underneath that. But it's really important to know and explore your options, because we know it's headed in one direction, these diagnoses, but what we never know is the speed or the intensity. And so to that point, some people get in some very sticky situations, and discharge dates certainly sneak up on people. So, and think about it, when we're stressed out, we have a bit of brain fog. It's sometimes hard to make big life decisions, and it's already a lot to navigate. So do yourself a favor if you or a loved one has a progressive diagnosis. Even if you think never in a million years you would go to a community, just explore your options so that way you know what if, where you would maybe want to go. So,
are you really familiar with insurance as well?
Someone here is going to touch on long-term care policies, and we do, people do utilize the policies. Is that what you're referring to?
Well, I was thinking like, what does Medicare cover, and what does Medicaid cover, and what are all the other options, and how do those play into a decision like that?
Yep, and so most of the communities in our area are private pay. Most people are shocked to find out that Medicare doesn't typically cover this type of long-term care. Medicaid, there are Medicaid placements. Typically, sometimes there's what's called, in some of the senior communities, for example, the laws are different state to state. So in New Jersey, there are some communities that have to allocate a certain percentage of their beds towards Medicaid, but they require a period of private pay before they'll allow someone to stay. So basically it's like locking yourself into a nicer community. However, you have to do sometimes some pre-planning, which we're going to hear from a trust and estate lawyer, or maybe you want to work with an elder law attorney. Depending on what your overall financial picture may be, that could be a possibility. If you have just a bit of a nest egg, that's a nice way to slide into a nicer environment. Or if somebody's just only on Medicaid and that's their only resource, again, typically they're going to skilled nursing facility or some assisted living placements, ALPs, that sometimes don't have that higher enhanced license. So if you have a lower care level, that may be a good fit, or the skilled. So it really, as I'm explaining all this, you can see how multifaceted and dynamic it is. So we are all very individual in this room, so it's not one size fits all for anything, I think, in life, let alone this type of decision. So it really depends on the person, their care needs, their budget now long term, and whatever else dynamics that go into that. So we can look at the big picture. We like to put all the cards on the table, and then that way you can make your best informed decision. And sometimes that's also exploring things like home care, which we'll also touch on this evening.
Okay.
I will say too, like, because it goes hand in hand. A lot of our clients transition into assisted living, and it's interesting when any facility you go to. I mean, they're beautiful, right? And it's easy to like visit and get wrapped up in the amenities and what they have, and the media room, the workout room, and these things. But like having someone like you is incredibly valuable because you get to navigate what's really there on the inside and what's going to be right for them as far as the care goes. Because it's so easy to get like wrapped up in enamored when you go on these tours.
Absolutely, I appreciate that point, Frank, because it's so true. You cannot judge a book by its cover. I've had certainly people we've gone to see some of these beautiful communities, but unfortunately sometimes the care needs aren't always there. But sometimes there's beautiful communities that can do very high care needs. So it really just depends, but it's a very good point. Thank you.
Thank you so much. Next, we're gonna have Marni Blank begin with Deanne.
Hi everyone, my name is Marni Blank and my business is Begin with the End, and I am an end of life and legacy planner, a death doula, and an after loss consultant. So why or how would I get into this work? In 2018, I was just at my regular job. I was at an event and I got a call from the hospital that my mom had been in a freak car accident. And the first thing that I thought of when this happened was, beyond is she okay, was, oh, I have her important paperwork sitting on my desk that I was supposed to get signed and notarized that I had not. And I am a lawyer. I am smart. I am organized. And there was a mental block around dealing with things that had to do with my mom's death. And I think that that is a case for a lot of people. And so she ended up being okay, but in the ensuing months of figuring out the rehabilitation center, the pet, she had gotten a kitten the week before, the mail, and being just an out-of-state child with a full-time career was incredibly overwhelming, and I wish that I had had someone there to support me through this process. And when someone is critically injured, it's very much similar to when someone is close to the end. So I ended up going and doing death doula training. And so my work really falls into three parts. First, I do end of life and legacy planning. So a lot of people think about a trust and a will, and we'll hear from Barbara, and these things are really important. And end of life planning does go beyond that, and it's really thinking about what's important to you as you age. Are you having these conversations within your generations, within your families, and within your communities about what is really important to you and how to make sure that your wishes and your values are followed at the end. And so I work with people on that, as well as making sure that your important documents are organized and your digital life is organized. The average person has 240 online accounts. If someone had to go into my brain and figure out how to pick up my life, where would they even begin? So I work with people of really just figuring out what they need. The second part is the death doula, and that is someone who educates around death, dying, and grief, and is really there for both the practical and the logistical aspects closer to the end. And so I work with families and the dying to make sure that wishes are being followed and that they have the support that they need. And that can look like making sure that they've done planning for a funeral in advance to take that off of the weight at the very end. It can be helping a person write letters to family, or to just be there as a support, because a lot of people feel a lot of feelings at the end: resentment, anger, sadness, fear, and sometimes they don't want to share it with their families. They don't want to be an extra burden, and so I can be someone who can come in and listen and just create like a warm and loving environment at the end, or create legacy projects. I gave you all a handout that has legacy project ideas that you can either do yourself or have someone help facilitate. This can be doing audio recordings. I have a 102-year-old grandmother on one side and a 102-and-a-half-year-old great aunt on the other. And the three things that they have chalked up to their success are they both have a view of the ocean or the water. They both had careers that really motivated them. And they both have chocolate or dessert every day.
Good genes.
And good genes, yes. Good genes. And so, yeah, thinking about how do you want to be remembered, and you have the opportunity now in advance to be thinking about this and sort of driving the boat. And then the last thing I do is after loss consulting. And so when someone dies, there is a ton of paperwork and logistics that fall on an overwhelmed executor, who's usually an adult child or best friend or spouse, or the family. And so I help create a roadmap of what are the tasks that need to be done and in what order is important. And I facilitate the conversations between the probate lawyer and the financial planner. And I take all of those little tasks off their plate, because it's really hard to be in grief and dealing with the logistics. And if you're just in logistics mode, you can't be in your feelings, you can't process, and you can't move forward. And so how can you have the support you need? So really my services are about making sure that you have the support and have someone to ask these questions to. No one wants to talk about death, but once you start having these conversations within families and making sure that everyone is on the same page, it really just becomes easier. So this is what I do.
Thank you. Any questions?
Yes.
How do you charge?
I charge hourly. Yes. Usually packages of 5 and 10 hours, but I work with the individual. I do virtual appointments across the city and across the country, but for people who live in Manhattan and Brooklyn, if you want in-person visits, I do in-house.
So you are national.
Yes, yes, we do. Yes. Thank you.
Thank you. You know, again, I keep relating everything to personal stories, but when my mother turned 89 in September, and she's in great shape, physically and mentally, but the next day she had an appointment with somebody, she arranged for her funeral, she bought the urn, she's like, okay, your father's ashes are in this closet. When I go, open it up, there's room for both. Like, she was very matter of fact about it, which honestly, and she kept saying, I hope this isn't upsetting you, and I was like, wow, this is great. Like, I don't want to be thinking about this, you know, and it's, so when Marni and I met, you know, and I was just, you know, the things we learned, like after somebody passes, get lots of death certificates. You can cancel their cable and their insurance, and there's just so much to know. So
It's really a gift to to plan in advance.
yeah, it really is. That's the way my brother and I look at it. Okay, so next we're going to hear from Frank DiMaggio.
Hey, no relation to Joe.
DiMaggio, yeah. He's probably been saying that his whole life.
I mean, I maybe down the road.
Yeah.
Somewhere.
Frank DiMaggio of Life Group.
Yeah,
All right.
thank you.
All right. So I've been in home care for about 13 years, in a different capacity than before LifeWorks. I was with a nonprofit, and when I transferred over to LifeWorks, it really made a world of difference. So I came from a world that was Medicaid, and it was low paying for caregivers, and it was really hard to find good people. So going into LifeWorks, we're able to be more selective. We're able to really find excellent caregivers that love what they do and do this as a career and pay them well. I don't know if anybody in here has experience with home care, if they have a loved one who's received it before, but there's essentially like 3 different ways you can go about getting care at home. And some have benefits that are better than others and deficits, but so you can go the private route, right? You can find somebody on your own, you can locate somebody privately, pay them directly, and that is obviously the less expensive route, but it comes with some caveats where there's no liability insurance, you're kind of at the helm, you're considered the employer, and also, God forbid, if they have a call out, if there's an emergency, you're kind of left high and dry if they can't get there that day, right? Another way to go about it is a registry. So with a registry, a lot of companies will do something where they'll find a caregiver for you. You don't have to do the legwork of actually reaching out and looking for somebody that you think is going to be a good fit in the home. The registry will find somebody, they'll vet them, they'll do the background checks, all the paperwork, and they'll find somebody that'll be a good fit for you. And that usually comes with like a fee. So you would pay a fee outright and upfront, and the insurances that come with that vary between different companies and different registries. It could be a certain percentage that they would charge you for the amount that the caregiver is working for the year, like a nominal fee. And then the other option is an agency, and that's what we are, LifeWorks. So with an agency, it's a bit pricier because it's generally charged by, we'll get into that, but there's 2 ways to charge when it comes to agencies. There's hourly, and then there's a daily rate. And the question I always get from people is like, how does it start? How do you do this? What are the minimum amount of hours you can start with? How do we find the right caregiver? How do we know if it's the right fit? And to be honest, most agencies have like a certain set minimum, whether it's amount of days or amount of hours. We particularly, it could be anywhere from like 3 days, 5 hours, to 2 days, 6 hours, to 1 day, 8 hours. And then it goes all the way up to 24-hour care. And with an agency, you get that assurance where if somebody cannot be there on shift, you find somebody right away to get there, somebody who's heavily vetted, somebody who has similar experience. Us particularly, we always want to find caregivers that have private home care experience, specifically because they're working in the privacy of your home, right? So that's really key and important. It's a whole different ballgame from working in a facility where they're on a floor working with 3 or 4 people. It's much more personal. Especially being in someone's home, and who honestly wants to have a stranger in their home, right? It's stressful and it's difficult, and we really try to mitigate and make that like as seamless as possible. So we want to set up introductory meetings. We send bios over to give you an idea of who the caregiver is, their interests, their clinical experience, things of that nature, and we really focus on not just finding the right match as far as the clinical aspect of it and what you need medically and what help you may need, but also finding the right personality fit. People with similar interests, people with similar backgrounds. Believe it or not, some of our caregivers have incredible backgrounds, and they're pretty amazing people. But as far as the care goes, for like, if you ever get to the point where you or a loved one needs 24-hour care, there's 2 ways to go about that. There's the hourly rate, which if you need care on an hourly rate, it would be because somebody maybe is diagnosed with something like dementia, they have sundown, or they're frequently getting up in the middle of the night and need care and could be a fall risk. I know all this is so fun to talk about, right? But at the end of the day, like, the only thing we have in common is we're all aging, we're all getting older, and it's almost inevitable. So the fact that you guys are here and even taking that first step is huge. But back to the 24-hour care. So there's you can go about it in an hourly manner, but then there's also a daily rate, and most agencies have this as well, where they charge you a daily rate for a live-in caregiver. And that, it's a good way to save $1. However, legally the caregiver is required to get 8 hours of sleep at night and have 3 hours of mealtime as well. And, having somebody in your home, in your space, it could be difficult, and that's something you'd have to consider as well. Like, how do we accommodate this? Do we have the space for this? So if you're in a studio apartment, it could be challenging. If you have an extra bedroom, but you also have people visiting, that's things to think about. And there are a lot of dynamics when it comes to the caregiver being in the home. But I'm happy to answer any questions, obviously. But as far as like when is the right time to get care, and when do I need care? Which route do I go? Do I get someone privately? Do I go to a registry? Do I get someone through an agency? And it really comes down to preference and what you need and what you're looking for. If you just need somebody for like 1 or 2 days for a couple hours, like going private might be the right route. But if you need full care and you don't want to have the burden of managing a schedule and worrying about the liability, worrying about the payment, worrying about if somebody can't be there that day, then that's where an agency is really key, and can just make life a lot easier and a lot seamless. But the unfortunate reality with home care is it's expensive, no matter which route you go. Even if you're paying someone privately, and you're quite honestly, like any caregiver these days that is working privately, they want between like $20 and $30 an hour. Most agencies can charge anywhere from $30 to $50 an hour, which it's a lot, and that's tough, and that comes into play a lot when it comes to making decisions on what care you want, and what care you need, and what how many hours a day you can even do. Medicare, our agency is specifically private pay and long-term care insurance, but I know Medicare covers maybe like 28 hours a week total, or 35, so it's it's not a whole lot. So it's a lot to keep in mind, but yeah. So I don't know, any questions? I'd be happy to answer any questions.
Do you coordinate with somebody who has Medicare coverage?
So we don't accept it, unfortunately. Quite honestly, like our rates to be specific are around $40 an hour, which are fairly high, but the majority of that goes to the caregiver, and we set it up that way because we want to ensure that they get paid well, they're not looking elsewhere for other work, and we ensure consistency, because the last thing anybody wants, especially if they're suffering from like dementia or Alzheimer's, is having a different person in the house every day. So we really take our time and focus and hunker down to make sure we find the right person who can go in the house and be a match made in heaven, and they're there indefinitely.
Are they trained?
So that's a good question. So most agencies, they would provide training. So a lot of caregivers, they go to school, they get like an HHA, which is a home health aide, or a certified nurse assistant, or a PCA, and then they would go through training with the agency. Us specifically though, however, we only hire caregivers that have been doing this for a minimum of 5 years, and all of them have private home care experience, and we're pretty thorough with references. Quite honestly, if we get like 100 applicants, we're only hiring between 2 and 5 of them. So we really, we look for a lot of details to make sure that they have what we're looking for and that they have what you guys would want. But anybody that would be going into your home would have references from areas that they're serving, and it's not like a friend or a coworker. It's a loved one of someone they provided care for without knowing them beforehand. So, sure.
Are your caretakers your employees or employees of the?
So our caretakers are contractors, but it's an interesting dynamic because we're still covered with general liability, and we have workers' compensation and the whole.
You're covering the workers' comp.
Yeah.
And
Correct.
and the long-term, whatever it's called, disability.
Yeah, just general liability.
So you're the employer of record as opposed to the.
Yeah, I mean when it comes to agencies, the agencies.
No, some agencies.
Yeah.
I have an agency.
Okay.
And I'm the employer, which was a bit of a shock to me because the paperwork involved
Okay.
in taking care of all the various requirements is.
Yeah, I mean it's an interesting dynamic. Yeah, a lot, like most agencies, I would say they're employers, right? And it's pretty clear cut. They provide the benefits, so on and so forth. Some they have caregivers as contractors, and they may have the breakdown where like you're responsible for all that, the liability and
No,
the insurance and
they
things like that.
cover the liability.
Okay.
You
Yeah.
know, I'm the employer.
Yeah. Okay. We'll talk about that more.
Okay. That's interesting.
Okay, well, Frank, my mother, who I'm not just like making up stories about her, or my father, but she's exploring the idea of getting some help, and Frank actually hooked me up with his counterpart in West Palm Beach. So these guys are more than just here. I think a lot of us, myself included, we can all refer people in many other parts of the country, just so you know. But and one of the questions my mother has, she has long-term care insurance, and you guys don't directly accept that.
Oh, we do.
However- Oh, you do accept that?
Yeah, so we actually, not only do we accept it, but we have somebody in-house who actually can set up the plan, work directly with the provider and process the claim, assist with that, and then
okay.
we run it so that, the care notes are done by our caregivers, and we send them directly to the insurance company, and you can do it as there's two different ways you can do it. You can do it as assignment of benefits, you can do it where you pay directly and we send everything over and then you get the reimbursement. So it's a matter of what's most convenient. But
Okay, good. That wasn't a setup, by the way.
yeah, no. It's okay. Yeah, and
I was mistaken.
There's, honestly, there's so many home care agencies, and it's overwhelming. If you were to Google on your phone right now, home care agency near me, there'd probably be 100 that pop up, and it's always well, who do I call, and what am I doing here, and sometimes it could be aggressive. You call one, and then they're gonna follow up and call you every week, and it's I'm still thinking about this, buddy, slow it down. So, I get that, and it's challenging, but you want to do your homework and really try to do your research and make sure you find one that's right for you. So,
Great. Thank you so much.
yeah.
Okay. So next, we're going to hear from Barbara McGrady of Davidson, Dawson, and Clark. Barbara and I met when we worked on a transaction together, which was actually a sale of an apartment in this building, a long-term, a couple actually who had been here for a long time, sold their home recently, and that's, I'll let you talk about it.
Okay. Hi everyone, I'm Barbara McGrady. I'm a trust and estates attorney, as Bill already told you. My firm is Davidson, Dawson and Clark. It's a small trust and estates boutique firm that's been in existence for 75 years. We just celebrated. And what I do basically is a lot of the planning that that hinges on everything that everybody that just spoke does, and that is, planning for the inevitable, planning for death, estate planning, making sure everything is done the way you want it to do, but also to kind of also tidy up your life now. Everything that everybody just spoke on is talking about areas where we all need some help with something, whether it be physical, mental, help with the move. Everybody is aging now, and we're realizing that, realizing that there are just some things we just can't do for ourselves anymore, and not as easily, so we need help. So I'm not going to focus so much on trust, wills and trusts tonight. Excuse me, I'm a little overwinded. But instead, what I like to call life planning documents, because these are the things that we need while we're still above ground. And that are healthcare proxies, living wills, and powers of attorney. And what each one does, what the purpose is behind each one, why you might or might not want one. So I think I'll go with the first one, and that is there are handouts here for everybody if you want to take them when you leave. So the first one is a healthcare proxy. Does everybody here have one? Okay, good. So as you know, that is a document that appoints an individual to make healthcare decisions for you in the event you're unable to. So whether you have diminished capacity or you're in a horrible accident and you're in a coma, and the healthcare providers need to know, well, we've got to get her into surgery right away. Your healthcare proxy will make that decision. Yes, give her this treatment or not. That is the actual legal, statutorily recognized document that gives somebody the authority. Under New York law, only one person can act at a time. So sometimes people say, well, I'll just leave it to my kids. I don't need one, just my kids will decide. But if brother and sister aren't agreeing on the care, that creates a problem. So it's really important to have one person appointed, so that person can act, and that's who the healthcare providers, the doctors, the surgeons, the hospital, the nurses are going to deal with. You can name an alternate. I name my son. If my son isn't available, I name my daughter, so forth and so on. So it's important really to have this document. And if usually when you go into any kind of care in a hospital emergency room, if you don't have one, they hand you this blank form. The other document that comes along with it is a living will. And a lot of people consider this document to be the pull the plug document. What happens if you're met with end of life decision of either putting a person on life support or taking a person off life support, giving them that certain treatment that's only going to prolong their death, or give it to them with hopes that it's going to prolong their life. But this document, the living will, is not legally recognized in New York. It's really just an expression of your wishes if this situation arises. The healthcare proxy is what gives the person the authority to act on your behalf. So if the decision came up, what do I do? That person has the authority to decide. The living will is a guideline for that person to say, if I ever get into this situation where there's just no hope, don't be a hero. Don't tell it. Other people don't necessarily agree with that, and they don't want something in writing. But what this does is it gives your statement to the world what your wishes are if these extreme measures do become necessary, and it prevents a court battle. I guess you all might remember the situation down in Florida, Terry Schiavo, with her parents and her husband fighting, and it was just a very prolonged process. It was horrible. Horrible for the family, horrible for her memory. Just horrible all along. She didn't have a living will. So some people might think, and you can, there's no set form of a living will in New York either. Some can be very generic. In fact, the one that I have provided is kind of just very generic. It really doesn't say a lot. Some people can, say, well, do it, but I still want you to give me cardiopulmonary resuscitation, or you can still feed me, So sometimes you'll see them, sometimes you can go online and you can find a whole host of different examples, and there will be a whole list. Well, if this, okay, check it off, and it can drive you crazy. Just keep in mind that it's really just an expression of what your wishes are, and if you're really just like, let me go, you might just want to, less is more sometimes. The next document, which I think is the most important, is a power of attorney. And I'm not sure if you all have one or if you want one, but what that does is it appoints an individual or individuals to act on your behalf, whether or not you have the capacity. So I told my aunt and uncle, they made me their agent under a power of attorney. And I told them this document is so powerful that it gives me the power to sell your house, take your money, and put you on the street. It's really that powerful a document. So if you do consider doing one, you have to be very careful. And in fact, the New York legislature has done that. This used to be a very simple 3-page printed form that you could get in any stationery store. And fill it in. I appoint Barbara as my agent to act on my behalf in all matters. And then I would go about robbing them. But there became a lot of elder abuse out of that, a lot of unscrupulous people, some aides, other people taking advantage of elderly people and doing exactly that, robbing them. So the legislature made it a lot more difficult to do this. It's still possible, but they made it a lot more difficult. So it's a much more formal document. There's a big warning at the front of it. Beware before you sign this. You consider that it's a very powerful document. Think about who you're naming and so forth. But what this does, so it does name somebody to act on your behalf, whether or not you have the capacity. It's a durable. That's what's called a durable power of attorney. It means that if you end up becoming incapacitated mentally, that person can still act on your behalf. But it helps with all of anything that you could do while you're alive. Your banking, your insurance claims, dealing with Medicare, Social Security, anything that you can be doing for yourself. But it's also a good document to have if you do lose your capacity, your mental capacity, and you haven't done anything, and there is nobody who can now act for you, what happens? Somebody would have to now go to court and have a guardian appointed for you. And that's a very long, unpleasant, arduous, expensive, undignified proceeding. As much as the law tries to protect the person who is called the incapacitated person, there are some protections for your dignity. It's really a horrible proceeding. So this would prevent that from happening. So it's a really good idea to have a power of attorney name somebody. You name somebody that you trust. Most often in my practice, it's always usually the parents naming one of their children or both of their children. Sometimes they want both of them, they have to decide together. You know, it can't be just, you know, Susie making all the decisions. Or, you know, they name each other, or then they name a friend. Some people name their professionals, some people name their accountants, somebody that they've trusted for, you know, 20, 30 years, who knows everything about them, all their financial information. It really all depends on your relationship with the person that you would want to name. So those are the three life planning documents. Obviously, this kind of ties in a lot of with what Marni was talking about. You know, she was doing all the organization. This is part of that. This would become part of what she works on to keep it less messy for you if you had suffered a catastrophic event. And you know, this also segues into you know, when it comes time for the individual to pass, this is all part of a package of what we do, you know, whether it be a will, a trust, a combination of a will, a trust, and some estate planning, tax planning, and so forth. But this would be, you know, part of that whole package. But if you have any questions about that, we can talk afterwards. But if anybody has any questions about these documents, fire away.
Are these state-dependent documents?
The New York State Power of Attorney it's a statutory form. You can get that from the Bar Association. That's the stamp book that I have here. But you have to be very careful the way it gets filled out. It requires 2 witnesses. It requires a notary public. That's what the legislature did to make, you know, to put in some more protections for people, so it's not so easy.
Suppose you have one from out of state, though. That's, you know, signed and sealed by lawyers from another state.
It depends. It depends. Sometimes banks don't even recognize this form. Sometimes banks want you to use their form. And the legislature has tried to work around that, used to impose penalties on financial institutions. It wiped that away on the most recent legislation. But it depends. So usually if it's recognized, if it's good in the state in which it was created, it should be recognized here as well, and vice versa. But it's good if you're living in 2 states, or if you're, you know, Florida and New York, it's good to have 2 sets.
2 sets.
2 sets of documents. Yeah.
To be sure I understand, the New York Power of Attorney has to be on that form?
It has to substantially comply
With the form.
With the form. Substantially comply. It doesn't have to be exact. It used to be. That was another thing.
Does it have to have that warning on it? I mean, mine doesn't have that warning on it.
No, it doesn't have to.
Okay.
It doesn't have to. It's just that this was what the state decided was the proper short form power of attorney. You might have a long form power of attorney, which is, you know, declared by your attorneys. But this is basically, this is what's recognized by statute, and it just as long as it substantially complies with them. Any other questions?
No, thanks so much.
Well, thank you so much. So I want to make some quick comments. I've done all of this. I was a Boy Scout. Our motto was be prepared. I'm 88 years old, almost the age of your mother, a few months younger.
You don't look it.
My plot is ready. All the documents are signed. all the dots are dotted, the I's are dotted, and the T's are crossed. That's realistic. I taught the psychology of aging. I'm a developmental psychologist, though I focused in my clinical work on infants and children and adolescents. But I also was a professor and taught what happens in old age. My advice as a clinical psychologist is count your blessings, be prepared, do everything they're telling you to do, but enjoy every second you now have. Nothing is forever, but enjoy every second and get the most of it, because as of now you look pretty lively. And
I think we can all get behind that. Thank you. Okay, well, our final speaker is Michael Silverman of Silver Lining Insurance, who is also a fellow shareholder and resident of this building. And I'm going to let you take it from there.
Thank you. Those of you who live in the building, my wife and I moved in the middle of COVID. So everybody was hunkered down, so you didn't see us. So here we are. So thank you for having me. I handle the insurance, all lines of insurance, but tonight we're going to talk about long-term care insurance because it dovetails with everything that was said tonight. In essence, I pay for everything they want to do. So, what is long-term care insurance and why should you have it? And there are so many myths around long-term care. I don't need it, I got kids. Really, I'm the kid, okay? My parents are 89 years old. My father has 24/7 care, okay, in the house. Allows my mother to go out and have a life, but come home and still be with my dad, and they just celebrated their 67th wedding anniversary. You know, so, but every month, the home health care company sends an invoice because we have 24/7 care. The woman lives with my folks. She's become part of our family. We were very fortunate. We had a couple of false starts as we went along, but we found the right woman now. But my mother just passes the bill to the care coordinator at the company because Bright House, her insurance company, pays the bill. It's wonderful. It's wonderful to get a bill enough to pay it. If I could just do that with the building, that would be great. But what does it do? Some companies, some insurance companies will pay a daily benefit, some pay a monthly benefit. It doesn't matter. They're basically the same. It's you take your daily benefit, multiply it by 30, there's your monthly benefit. Okay? There's a waiting period to start coverage. 30 days, 60 days, 90 days, some even 180 days. What does that mean? I have to have care. I have to be paying for licensed care for that period of time before the insurance company starts paying on my behalf. For those of you who have a car or an apartment or a house, it's your deductible. That's it. Once it's done, it's done. Some policies, if you start paying and then get well, you can bank the days. Some not, some yes. The long-term care insurance marketplace has changed so dramatically over the last 15, 20 years. Price has gone up. Price has gone up a lot. Okay, a lot. And the problem is when they increase your policy, frequently you're at a point in life where you can't get a new policy at a lower price because you may not even be eligible health-wise. And who wants to pay the new price? But you don't want to, you've paid all these years. Yeah. Now, do I cut my coverage to pay the same premium? Do I keep? So these are conversations we have with people around what's important, what coverages do you have and why? You know, the myths are, as I said, I have children. Medicare will cover it. For those, someone asked about Medicare. Medicare doesn't cover it. Let's just lay it out there. Assume zero, because it really doesn't. Okay? Or, I'm healthy. I'm gonna be fine. You're healthy now. As you said a little while ago, enjoy every day. You don't know what tomorrow brings. Or I have friends. Friends don't want to do it. Okay? I love my dad. I do. I love my dad. You take this face and go out 30 years, that's my father. We are spitting images of each other. Okay? We were business partners for years. Okay? But guess what? I don't want to take care of him like that. I'll take him to the ball games. I'll take him to lunch. We'll go everywhere. We'll do everything. Let someone else make sure everything else is taken care of. Kids don't want to do it. Family doesn't want to do it. Friends don't want to. The long-term care insurance is so imperative to protect your assets, to protect your estate. You know, people talk about life insurance. Life insurance does two things during one's lifetime. For the young family that buys life insurance, it creates an estate. When we get older, and then our children are grown, we have grandchildren, and we pass away, it protects the estate. Long-term care protects the estate. Some people say, I'm just spending my kid's inheritance. Okay? My father used to like to say that to me. I'm just going to spend your inheritance. No, I'm not. No, you're not. No, you're not. You already bought the long-term care insurance. You sold yourself the long-term care insurance. Don't give me this stuff. Okay? I didn't make a commission on it. You did. So this is what we talk about. We talk about what can we do to pay the bills, the daily benefit of having someone, and what does it take to trigger the coverage. You'll read, there is so much out there, okay? Activities of daily living. If you can't do them, and every company, again, is different, okay? We are not being insurance company specific in this conversation. Some companies require that you cannot do 2 of the dailies. Some do 3. Very few today do 4, okay? Eating, transferring, toileting, dressing, etc. Can you do these things? Can you not? How do they know? Does my wife tell them, he can't do that? No. Okay? My wife probably thinks I can't do it now. Okay? But they come out, they see you, they do a visit. Okay? And what I try to explain to everybody that I work with, whether on the long-term care side, on life insurance underwriting, on, God forbid you should live in California right now and have a homeowner's claim, you know, underwriters and adjusters and claims people, they're people too. They have moms and dads too. We may not think so, but they really do, and they want to pay the claim. Insurance companies, please hear me when I say this, they are not in the business to not pay a claim. They are in the business to pay claims. It's just to pay it properly. They don't want to get screwed. Okay? And unfortunately, what do you read? You read all the people who are trying to cheat. You don't hear about the good people. Okay? But the insurance industry is out there to pay claims. Long-term care insurance, as I said earlier, it has changed dramatically. My policy that I bought when I was 40 years old is lifetime coverage. That's great. Lifetime. Because I don't know what lifetime is. Some policies are 5 years, 3 years. But please understand, when you get those timelines, which is not uncommon today, 5 years is a very common time. That doesn't mean you have a policy for 5 years. That means you take the amount of money that you purchase, the insurance coverage, times the number of months in the year is 12, times 5. That's a pool of money. So if you buy 6 years, it's times 6. If you buy 3 years, it's times 3. So you have a pool of money. Some policies have inflation built in. Some don't. Some you had an opportunity to buy inflation each year. And if you said no 2 years in a row, you don't get another choice. Some automatically include inflation. So there are so many different ideas and options inside long-term care coverages that the insurance companies got killed. When these policies came out truly in the late 70s, there was no empirical data for the insurance companies to build their rates on. So they went like this. They threw a dart. They missed. They missed big. They didn't expect people to start living to 90, 100, 105. Just didn't expect it. They didn't expect medical care to get so advanced that people were living in various conditions. That's why rates are skyrocketing, because they were so underpriced. Most insurance companies have stopped writing long-term care insurance, period. Not like you hear about, they don't write insurance in California. They don't write their policies anymore. The old traditional long-term care policies are available. The majority of insurance companies now write them inside life insurance contracts. Doesn't make it good or bad. To use a really lousy phrase, you kill two birds with one stone. Okay? Come on, that was an insurance joke. It's all we got in the insurance business. Okay, but it's about having conversations about what's important to you and your family. What do we want to protect? Dollars and cents and dignity. Everybody talked about dignity and everybody talked about money. It's protectable. Okay? If I may just jump back to one thing. One thing Barbara talked about is the living will and the power of attorney and everything. And it's an absolute requirement. But if I can make one additional recommendation, so for example, when my dad went in for care, they wanted a copy of the documents. They wanted us to prove that either it was me or my mom, etc. You gotta know where the document is. You gotta know, your family members need to know where the documents are. What we have started doing is we have built a secure site in our website with passwords, etc. It's almost like a lockbox. So I go on and I set this up in advance, so I didn't have to go log in, because we were joking before, I have one password to everything in my whole life. I just have to look it up. Okay? There's my dad's power of attorney. It's right here. So when we were at the nursing facility, because he had to go in there first, email it right to them. I can't tell you where the real document is. I know my mother knows, probably in her safe, but I know where this one is. It's that kind of stuff, so we should talk about it. So long-term care is a scary conversation because there's no end. When does it end? Is it when you end, or is it when the money ends? And it could be either. So, please.
One of the questions that I have, if you, for instance, buy a package, a 5-year package, and you die before it even kicks in, what happens to the money?
Some policies have what's called a non-forfeiture option. Pay for that. And you can get some money back. Other policies, it's like an automobile policy. I've paid all these years, I haven't had an accident. Flush. Some are that way. It's like term insurance. If you pay and don't die.
It can go to your beneficiaries, yes?
It can. It can. You have to pay for it. It is a high premium endorsement on the policy. Most people don't buy that, unfortunately. Please.
You've now convinced me that this is a very complex, difficult kind of thing to get through. Is there something, you represent one company?
No, I represent many.
So are you the equivalent of Katie and Diane in terms of helping people sort through what all of the options are across multiple companies, or?
On the insurance side, yes. On the where to go, who the caregiver will be, no, that's not me. On insurance, yes. Should you have, I'll make up names just for conversation purposes, should it be Bright House? Should it be Aetna? Should it be this one? Should it be that one? Should it be John Hancock? Yes, then we have conversations because they're different.
So
That's
you're
my
a
job.
Broker,
I'm a
so
broker.
to speak,
Yes.
across all the insurance
Correct.
companies. Okay.
Yes, that is my job. I lay out the options, column A, column B, column C. We have conversations about, and I do everything in my power when I have these conversations with people to literally make them column A, column B, column. I don't want you to know the insurance company name until we have conversations afterwards. I know them. I don't like their ads. Okay? I gotta tell you something. I don't sell Geico. I love their ads. And it kills me to like their ads. Other questions, please.
You mentioned how it's getting more expensive.
Yes.
It's gotten very expensive. As people age, at some point, I have to believe the economics don't work anymore, that the premiums have gotten up to a certain point. Do you have a sense as to at what point that that
I have
kicks
to
in?
throw in a curveball to your question. It's a great question,
I'm
and
sure
it's
it
right.
depends.
The depends is your economics, your family economics. We have sold these policies to 80-year-olds, 83-year-olds, 85-year-olds. They're more expensive, obviously, but there's so much money to protect. You know, now the conversation, 85, how long are they gonna live? They got 15 max? I don't know. Could be 20. My grandmother lived to 104 years old, and you'd never know it. She lived on 57th and 3rd. And by the way, she died the best way. She went to sleep. She went to sleep. That's the way to go. Okay? And she was with it. You know, you talk about you don't know. This woman every day at 104 on 57th Street, every day went out and did one thing. She walked into Bloomingdale's just to see people. Just to see people. Hello, how are you? Good to see you. She didn't shop. God bless. I'll take it in a minute. I'll sign up now. You know, I don't have to have 104. I'll take 100. So it really depends. I'm sorry, I lousy answer.
I kind of expected something.
I have a question.
Please.
What's the most common age you see as far as people that are buying plans, and then what do you think is the best age to buy a plan?
It's getting younger and younger
Okay.
because the topic is coming out so much more. Okay. Now, pro and con to buying it younger. Pro, price is lower. Con, you're paying it for so many more years. Okay. When my wife and I bought our policy, back then we had to wait to be 40 years old. Because back then, they weren't selling to anybody under 40. I can tell you the exact date of my policy with my wife because it's the day after she turned 40. Okay? So, more and more people, the sweet spot of when are people buying it, 40 to 70. That 30-year window, 40-year-olds have to be convinced to buy it. The 70-year-olds have to be convinced that they made a mistake not buying it at 40. Because they say, what would it have cost if I bought it then? You don't want to know that. Because you're going to be really pissed at me. And price, unlike certain life insurance policies and disability policies, long-term care premiums are not guaranteed to remain the same.
No.
They can increase. They have increased. Whereas other policies are contractually guaranteed not to increase. Problem in the long-term care industry way back when was the insurance guys didn't say, oh, you know, this rate could go up. You didn't tell me that. And then we get into the problems of getting that letter, you're having a 15% increase this year. Oh, and by the way, we're going to do it again next year.
And the increase based on cost, not on your health.
Oh, it has nothing to do with you.
Yeah.
And just so that you know, it is all insurance is state regulated. So if an insurance company wants to increase rates, they have to go to the State Department of Insurance, and they have to take the entire portfolio. If I bought policy form ABC, they have to increase everybody who bought ABC. They can't say Silverman goes up. No, it's not individualized.
Okay, well, thank you so much.
Thank you.
Michael.
Thank you.
No, you're welcome. You're welcome. Yeah, I actually, Alzheimer's runs in my family, and when both of my fathers, my last anecdote, when both of my father's parents died from it, my father got long-term care insurance, and he insisted that my brothers and I get it as well, which is a really good thing. Knock wood, we don't need it, but I'm thrilled that we have it. Of course, now I have to look into what it actually covers, because when you buy insurance when you're 40, you're like, So anyway, I hope that you all found this useful and interesting. It has been a pleasure. We're so glad that you all came, and we have lots of material over there. Your agendas have all of our contact information. We have wine, water, food, so please feel free to stick around, chat with various people. Thank you, and I look forward to seeing you all again.
Thanks, Bill.
I know, I'm not positive things about it.
to wait for,
Yeah,
I know, I learned a lot.
Yeah, having gone through this